villages or parts of villages completely destroyed. And within those ruins, you see families with young children trying to rebuild their lives. The last time that I was able to visit Lebanon was in November 2024, after the conflict had re-erupted and a few days before the ceasefire was agreed. The situation, of course, was a lot more critical in the sense that the fighting had forced hundreds of thousands of people to flee their homes. Now, the ceasefire allowed many people to return home, but what have they returned to? Villages that have been destroyed, their homes have been destroyed. So they're trying to rebuild a life, but the fact is that it's not really a ceasefire. There are still airstrikes, there are still drone activity. The population are still living in a conflict zone. Or the areas where I was able to visit, mainly in the town of Nabitchem. Now, it took us many, many months to be able to access that area because of the conflict. We've now got teams there on a more regular basis, and they are implementing the medical activities. A lot of the activity is around mental health. The violence, the conflict, the constant airstrikes and bombings have left a population absolutely traumatized. The humanitarian response today is definitely not at the level it should be. The healthcare system was already fragile. The number of actors that are able to scale up and to provide support is diminishing. Many of them are suffering from budget cuts. Many of them are unable to operate in some areas in the south. What's been provided today is insufficient. So as in many regions where MSF work, especially over this last 12 months, where budgets have been cut, there has to be a prioritization for the needs of populations that are still in active conflicts. What it was clear for me during my visit that this is not a post-conflict recovery situation. It's extremely disheartening to see what this population have suffered and continue to suffer.